Assalamualaikum warahmatullahi wabarakatuh. This is case study 2 SLE by group 2. Number 1. The significance of the first laboratory finding is positive anti-nuclear antibody titer, which is a type of antibody that is directed against cells nuclei. It is used as screening tool by doctor to analyze the pattern and how it works against the body. The next one is positive anti-dsDNA, which is a protein directed against double-stranded DNA, and it's a very specific test for lupus. The next one is positive anti-SM, which is an antibody directed against the smooth muscle. This protein can only be found in up to 30% of people with SLE. The next one is elevated C-reactive protein, which is a protein in the body that can be a marker of inflammation. The next one is elevated ESR. With the increase of sedimentation rate, the greater the inflammation. The last one is decreased C3 and C4 serum complement, which is associated in cases of active SLE as it can demonstrate the classical pathway activation and strongly suggests immune complex disease.
Question 2. Given the most tests are non-specific, how SLE is diagnosed?
Screening test is used in detection of anti-nuclear antibody ANA in serum. ANA is autoantibody that attacks soft protein within nuclear structure. The most common tests that is used to detect ANA are immunofluorescence assay and enzyme-linked immunosorbent assay, ELISA. In IFA, the presence of ANAs in patient blood specimen is detected using cell line substrate from human laryngeal carcinoma (HEP2 cells). This cell is a sensitive substrate for ANA. The cells are incubated with blood specimen, and if the antibodies are present, it will bind to nuclear antigen. The antigen-antibody complex can be visualized in fluorescent microscopy, hence it is a standard method as it has high specificity and sensitivity. ELISA test is based on interaction between two antibody existing in blood specimen, prepared antigen and special antibody that are able to stick to previous two components that lead to color change in final solution. It is proportional to the quantity of ANA. Therefore, since her result is positive ANA titer, positive dsDNA, and positive anti-SM, it can be diagnosed her as positive SLE.
Question 3. What priority problems were addressed in DW's care plan at the time of diagnosis?
Okay, so the priority problems that were addressed for DW's care plan at the time of diagnosis is to assess and manage her pain and discomfort by remind her to avoid prolonged inactivity period. Next is to assess and manage her fatigue by determining the causative factors. Next is to assess and manage her rash and vitiligo that appeared by instruct her to clean, dry and moisturize her skin and remind her to avoid UV ray. Next is to assess and manage her fever by administer drugs and advise her to get enough rest and healthy diet. Next is to understand the administration of medicine that related with SLE. And next is to advise her on ways to live a normal and safe life after the diagnosis of SLE.
The case study progress is as stated. Which laboratory findings are concerned and why?
Okay, so the laboratory findings that has been concerned is the elevated creatinine and bun. The elevated creatinine indicate that the SLE has affected the kidney causing nephritis, while the elevated bun may suggest that kidney has involved in the development of SLE. Next findings is the slightly high chloride, low sodium and slightly low total carbon dioxide level. These abnormal electrolyte concentrations indicate that there are abnormalities in certain organs, especially the kidney. Next finding is the proteinuria and hematuria that indicate the presence of protein and blood in the urine, where due to the SLE that has caused the immune system to attack the kidneys.
Question 5. How will DW's treatment and care plan likely change?
Okay, so the treatments and care plans towards these SLE patients are not to cure them because there's no cure for lupus nephritis, but the goal of the treatment is to keep the problem from getting worse and to stop the kidney damage at an early stage to prevent the need for a kidney transplant in the future. And the treatment can also provide relief from lupus symptoms. So the treatments and care plans towards SLE patient is to ask them to minimize the intake of protein and salt, administer blood pressure medication, using steroids, administer medicines to suppress the immune system, advise them to eat healthy diet, to do regular exercise, to have adequate rest, and advise them to organize their times and activities properly in order to reduce fatigue.
Question 6.
In order to know how much DW received with each dose of cytoxan, we can use the information given, which are weight and height, to calculate body surface area. But first thing need to do is convert the height into centimeter and weight into kilogram. By using this formula, the amount of body surface area can be calculated, which is 1.696 meters squared. 100 milligram is equal to 1 meter squared, so how much will be received for 1.69 meter squared? We can multiply 1.69 meter squared with 100 and get the answer is 169 milligram. But the physician stated that cytoxan is taken orally in 2 divided doses. Therefore, we divide 169 milligram with 2 and get the answer is 84.5 milligram per dose. This is the amount that DW will receive for each dose.
The progress of the case study is as stated. Question 7. Are the findings indicative of CNL's involvement from SLE should DW be assessed for?
Seizure is a sudden, uncontrolled electrical disturbance in the brain, involving both focal and generalized seizure. Stroke is a sudden interruption in the blood supply to the brain, as it caused by blockage of arterial leading to the brain. Next is cognitive disorder, such as dementia, where the individual experiences loss of memory and distortion of thinking ability. Also, by using the brain imaging, shown the reduction in the cerebral and corpus callosum volume in the brain.
Question 8. Preventive measures need to be instituted to protect DW at that time.
Anti-epileptic, including drugs such as phenytoin for generalized seizure and carbamazepine for focal seizure. Also, the anticoagulant drug that is for treatment of venous and arterial thromboembolism to reduce the stroke probability. Next, we have to manage the symptoms experienced by DW, such as headache and dizziness. This is usually the first step of treatment. Antidepressive is used to treat the depressive disorders such as anxiety. For example, tricyclic antidepressant TCA such as amitriptyline.
Question 9. Which of these care activities can be safely delegated to the NAP? First of all, NAP is abbreviation for Nursing Assistive Personnel. NAP work under the direct supervision of a professional registered nurse. The role that delegated to NAP doesn't require professional knowledge, judgment, and skill. The work that can be delegated to NAP including clerical duties, selected care tasks such as ambulation, feeding, mouth care, and bathing. NAP also did the data gathering such as intake and output and vital signs. So, based on the following option, the best answer is A, B, and E. A. Measuring DW blood pressure every 2 hours. B. Assisting DW with personal hygiene measure. E. Emptying the urine collection device and measuring the output. Question 10. What major complication associated with immunosuppression therapy? The major complication of immunosuppression therapy including increased risk for infection, change in vital signs, nausea or vomiting, bone marrow suppression, hair loss, and lethargy.
Question 11. DW asks about what plasmapheresis does and why might it help her feel better.
Plasmapheresis is a procedure where extracorporeal separation of blood components results in filtered plasma product. Blood is taken out, and then the plasma will be filtered and be replaced with other fluids such as saline or albumin, or in other cases, the plasma will be treated, and then it will return back to the bloodstream. The toxin in the plasma, such immunoglobulin due to the SLE, will be removed as the antibody attacks own immune system. This will increase the immune response of the individual.
Question 12. DW returns to floor following plasmapheresis. The vital signs is reported. DW complained of headache and dizziness. What is suspected occurring?
The vital signs are shown in the chart view. The most common adverse effect was fall in blood pressure. Her blood pressure is 86/43 mm mercury, and this indicates hypotension. Hypotension usually accompanied by significant changes in the pulse rate, which is 108 beats per minute. This will cause arrhythmias to occur, which the heart can beat too fast or too slow with irregular rhythm. Plasma contains a lot of water. For that reason, some people may experience dehydration after donating plasma or plasmapheresis. Dehydration is not usually severe.
Question 13.
The care that can be anticipated over the next 2 to 3 hours are the blood pressure to be stable, hydration, stable temperature, decrease in dizziness. Besides, making sure that the doctor is aware of her condition is also one of the care.
Question 14.
The outcome criteria that support the condition stabilizing are the stable vital signs, decrease in fatigue and tiredness, decrease in swelling and pain, and also the infection is reduced.
Question 15. 5 topics that DW must be taught before she is discharged. First, try to stay away from people who have colds or other illness, as her immune system is deficient and she might be easily infected. Second, she has to maintain good personal hygiene. Third, contact the doctor immediately at the first sign of any infections or illness. Fourth, taking medication as prescribed. And lastly, avoid sunlight as it may trigger rashes.
Number 16. To respond to the concern, I suggest to focus on how to manage and understanding the impacts. In this case, if DW finds enjoyment of her work, she should continue her work but should always be careful. She also should discuss and get the admission from her employer about her condition and needs. However, it is also significant for DW to avoid such work as it can induce stress which may worsen her condition. Have a good support system such as family, friends, medical professional, and also support groups such as Persatuan SLE Malaysia. Participating in support group can help provide emotional help, boost self-esteem and morale, and help develop or improve coping skills.
Thank you for your time. Thank you for listening. With that, we thank you.